I would like to take this opportunity to welcome us to our today's session of Eco Africa. And we are going to have a very interesting session on the opportunities for digital and mHealth technologies in survivorship. This is an area which we really need to explore because through technology, we are able to reach many of our clients and we are able to gather them together in one platform. And today we are going to discuss ways that digital and mobile health tools can help us to understand and address the health system issues on patients and cancer survivors, and also to explore examples of digital and mHealth solutions in practice and lessons learned and future opportunities that can come up. ECO is a platform which is bringing the entire globe into one platform, and that is the power of digital. Like right now, we are in different places, but it is able to put us together. So today we are going to have two speakers, and our first speaker today is none other than Omolola Salako. Omolola is a lecturer and a researcher at the College of Medicine, University of Lagos. She's listed as one of the 2021 brightest minds in cancer research by the Conquer Cancer Foundation, an oncologist, entrepreneur, and technologist. Dr. Salako's experiences in clinical oncology, digital health, and mHealth research, increasing access to value-driven cancer care in sub-Saharan Africa. She is the founder of several vibrant startups, Survivorship, Cancer Care, Pearl Oncology Clinic, Leki and Oncopadi Cancer App. And today she's going to tell us more about this. So I welcome you all. If you have questions, you can still post them on the chat, or you keep them at the end of the presentations. We will discuss them. So I welcome you, Omolola Salako. Remember our presentation, your presentation is supposed to go for 10 minutes. Karibu. That is the native language for saying welcome.
Okay, great. So I'm so glad to be here a second time. About this time last year, I was talking about another health tech intervention, but today I'll be talking very broadly on improving digital health, improving cancer survivorship using digital health. So I'm just trying to get my slide on, and give me a second for that.
Are you able to share your slide? Or have we lost you?
Okay, so got it. Oh. Okay. So hello again, my name is Omolola Salako, and very briefly I'll touch on the importance of using digital health and mHealth technologies really to optimize cancer survivorship in sub-Saharan Africa. And for us to lay emphasis on the importance of digital health, we first have to lay the framework of how well internet is available across sub-Saharan Africa. The GSMA did analyze this over the last few years. There are three columns here that I want you to pay attention to, and I'll be speaking to the year 2020. So what this image just explains is, first of all, about 28% of the population in sub-Saharan Africa are connected to the internet, have access to the internet, and just like me and Mercy and other African participants here, we are connected and utilizing the internet, but that's just 28%. Now to the blue box here shows the usage gap. So 53% of the African population have access to internet broadband, but are not using internet for many reasons. One, the cost of internet is high, the cost of data is high, affordability issues around owning a smartphone, literacy levels, people who can't read and write are not confident to access or utilize internet services. And to the minor group here, which in 2020, 19% of the sub-Saharan African population still don't have access to the internet. So if we want to improve cancer survivorship, we first of all have to understand what part of Africa we are creating solutions in. For the group that have access, who are connected to the internet, it will be very useful to have mobile apps and other technologies that are dependent on internet. While in this group, the 53% who do have access to the internet but are not utilizing it, they likely would have phones, but they are just not connected to the internet. You'll consider things like the SMS and other services that are not internet dependent. And for this last group, 19% who do not have nearby broadband where they live, we would then have to wait it out until the government and stakeholders get internet to such regions. So as we explore the ideas around mobile health and digital technologies in Africa, we have to keep at the back of our mind that internet penetration is critical. Now, an individual is considered a cancer survivor from the time of diagnosis through the balance of his or her life. And this is a definition by the National Cancer Institute, in which the NCCN supports the same definition. Now, bringing it into the African context, here is an image that depicts our survival rate. Now, I'm using breast cancer as a case study here, and I'm just pointing out with this image that most breast cancer patients from diagnosis up until death, in countries like Nigeria, we have about 64% of breast cancer patients dying within 3 years of their diagnosis. And so they have such a little time, 3 years, to balance all the components of their cancer diagnosis, how to cope with it in such a short time. So bringing the topic of mobile health or digital health, how can we use mobile health and digital health basically to increase this survival rate? Now, if we compare this to white Namibians, they have about a 10% mortality rate within 3 years. What I want us to take away is, as we explore mobile health and digital technologies, we have to speak to the problem in Africa, which is we have a very low survival rate across sub-Saharan Africa. So we're thinking of developing this mobile health that can optimize cancer survivorship. We first have to understand the pillars that represent a cancer patient's journey. And usually in Africa, many women and men will initially have symptoms, but they will present to the hospital at advanced stages. So for us to improve survival, and if we're using digital health as a tool or as a pathway to improve survival, our technology, our ideas should explore how we can reduce advanced stage presentation of African patients to the hospitals. Now, when patients come into the hospital, they get diagnosed, and in certain parts of Africa, the diagnostic and treatment services are weak. So a lot of patients are stranded in the hospitals or on the path leading to the hospitals. One way we can use mobile health to optimize this problem, or rather solve this problem, is to create navigation services, is to help cancer patients identify the hospitals where they can receive services quickly and the right places to go. Now, when patients start treatment, if they are fit for treatment or treatment is available in these hospitals, it's important to improve the quality of life. And this has improved quality of life, which starts from counseling, improving side effect control, preventing side effects, managing the symptoms, and so on and so forth. So the idea of mHealth technologies and survivorship should fall along this line in a bid to improve the survival rates in Africa. To touch on how cancer patients utilize the internet, just before the pandemic, we conducted this survey across 3 hospitals, and we identified 208, we recruited 281 participants. Majority were females, about 80%, and about 68% of them owned a smartphone, while 32 owned a laptop. Now, what I would like to point out is the fact that 43% of these patients, cancer patients, were e-patients. They had gone online already to seek information on their diagnosis, on their disease.
Oh, Malala, 4 minutes to go.
Okay, great. I'm on track. So half of cancer patients, in summary, half of cancer patients use the internet to obtain information about their. Half of cancer patients are willing to explore digital cancer care, such as online consultations. So as we explore the idea of improving cancer survivorship, number one takeaway is it's important to understand the customer's needs and the technology context. And this was a paper that was recently published by my colleagues and I, where we identified in 3 different countries, we conducted this multi-country study to understand the data and information needs of cancer patients. The second thing I would like you to take away is, once you have an idea, that's great. It's important that mobile health researchers follow a discovery process. There's so many problems contributing to the low survival rate in Africa, but we must use methodological methods to develop these solutions. We must understand how our solutions fit into the customer's life, which is the patient. And we have 6 steps here, which you can read later. Just to touch on one of the biggest problems facing the continent is the shortage of oncologists in Africa. In Nigeria, we have about 36 states, and in 18 states, we have oncologists. The rest of the country has no oncologists. And so we have a resource challenge where many hospitals, public hospitals, have a high volume of cancer patients, but they are being treated solely by surgeons and physicians, which is what is available. So if we want to improve survivorship, we have to be creative on how to get cancer specialists into these hospitals that have the greatest need. It's important to integrate the solutions into the existing healthcare systems. We must avoid situations where we create standalone clinics, or we collect data and that data is not useful to the hospital. And an example is this digital portal in one of the chemotherapy centers in Ogun State. Twice a week, patients come into this clinic and can remotely see clinical oncologists, even though there's no resident oncologist in that hospital. Okay, and so a case study that I'll quickly share is cancer patients who go through treatment experience a lot of side effects. One of the challenges we have is underreporting of side effects. Once the clinics are shut down by 4, there's no way to get in touch. Recently, we won a grant under the Conquer Cancer Foundation, and we're building this web application for patients who have already indicated. For patients in one of the largest cancer hospitals, and they have indicated that they want a 2-way communication system, especially during non-clinic hours. These are some of our research questions, and the it's called the PROS tool, patient-reported outcome side effects. It allows patients to report their side effects, allows the healthcare team to review the side effects and make clinical decisions. Our preliminary data are: 1, cancer patients undergoing radiotherapy have side effects.
Omolola, time is up. Just to summarize.
Okay. The head and neck cancer patient. Okay.
Yeah.
Okay. So the head and neck cancer patients experience the highest burden of side effects. Cancer patients are willing to use the PROS tool. Oncologists and the nurses are also willing to utilize the app. However, they have expressed concerns with their hectic clinic schedule. Thank you.
Wow, thank you very much. That was a wonderful presentation. Thank you very much. You stay a lot for question time and discussion. I think that is something we really need to explore. And on that note, I just want to thank you on behalf of ECHO. Our next speaker is Mercy Oduor. Mercy works at Empath or Academic Model, providing access to healthcare. She's been there since 2013. And Mercy is currently the program coordinator for multiple myeloma. She's dedicated in health promotions, which is her specialist interest. She's also one person whose role is to ensure that all patients who are diagnosed with multiple myeloma are enrolled into Empath program, and not only enrolled, also engaged in the support group system. Mercy goes all around in Western Kenya, different hospitals, giving health talks to healthcare providers. And through that, they have been able to identify and diagnose many patients who would have not known whether they have multiple myeloma. Mercy is a patient advocate and has closely collaborated with the other health stakeholders in information dissemination. She's also a counselor and engaged in many areas of policy making. And currently she's also studying epidemiology, and soon we are going to have Mercy as an epidemiologist. Welcome, Mercy.
Oh, thank you very much, Pam, for that elaborate introduction. And I'm glad for the platform offered to me by the Africa Cancer Echo platform to share our experience. Yeah, so today, mine is just to share our case experience while using the mHealth platform in survivorship care for a cohort of clients suffering from a disease known as multiple myeloma. So I'm trying to share my screen, and once you can see it, kindly let me know. So is my screen visible?
We can see your slide. Yeah, it's visible.
Thank you for that. So,
Go ahead.
So I work with Empath as a program coordinator, and basically my program coordinates a cohort of clients who have been diagnosed with a condition known as multiple myeloma. So multiple myeloma is a B-cell malignancy characterized by abnormal proliferation of the clonal plasma cells in the bone marrow. And it accounts for 1 to 1.8% of all cancers. And it's good to acknowledge that it is the second most common hematological malignancy. So just to that background to enable us understand the cohort of clients I'm talking about. And so in this slide, there's a yellow pot here where the arrows are pointing. This is where the health facility where we are currently in is. And then the arrows are pointing, or the shaded areas, all this area shows where our clients come from, like a mapping of all our clients. Some come all the way from this, they are seeking care in this one health facility. So this facility is called Moi Teaching and Referral Hospital, and it is it's actually the second largest public teaching and referral hospital in Kenya. And it has catchment area of at least 23 counties in Western Kenya. So that gives us an understanding that our clients travel very long distances just to get healthcare services in our health facility. So to continue the conversation, we thought of creating a support group for our clients, bearing in mind that multiple myeloma is a chronic condition, and hence we are ready to journey with the clients from the time of diagnosis to the time of their end of care, probably end of life. So before COVID-19, we could have physical support group meetings, but with COVID-19, which restricted gathering, restricted traveling, and all that fear, we decided to pursue this option of using mHealth platforms for survivorship care services. So here in our facility, we use these platforms, the WhatsApp platform. We also use Zoom, where we can have online meetings. We also use the short messages to communicate to our clients. When I say clients, I mean those who've been diagnosed with multiple myeloma and their caregivers. Being a chronic disease, you realize that a caregiver plays a very crucial component in their outcomes. So just to share a brief process on how we get our clients after a diagnosis have been made, or those who've been suspected to be having multiple myeloma and they have been referred to our health facility, they will land into our program. Thereafter, once a diagnosis have been made and we've confirmed a multiple myeloma diagnosis, we normally take the client through the health information that he needs to know, together with the treatment partner or the caregiver. So once that is done and the client accepts to go through treatment, we will also share with them the need of getting to be part of a support group, where that is basically for peer-to-peer support, health education, and the likes. So when they agree into that, they'll sign a consent, and then we will add them to our WhatsApp platform. And then basically after the consenting and we've added them there, we will introduce the new client to the ongoing client, like the old clients. And after that, the conversation begins. Actually, they are always excited even to welcome the new members just joining us. So I've just said that the platforms we are using are basically for health education, for spiritual encouragement, among others. So since 2020, around March, with the COVID-19, our response strategy was to go that way. So in our WhatsApp platform, we have 76 caregivers to multiple myeloma clients, and we have another WhatsApp group. So we have two groups, one just for caregivers and one now combined for our multiple myeloma clients and their caregivers. The reason why we went that way
you have 5 minutes.
Sure. Thank you for that reminder, more time. The reason why we went that was because there are some core issues caregivers would want to share in the absence of their client. So they requested, why can't we go that way? And so we have those two platforms. So in 2021, we had a total of 5 sessions. And out of those 5 sessions, we had a total of 154 attendees. So basically our achievement using this platform has been, we've been able to improve patient navigation and referral. This, I mean that clients who sometimes want to come to their clinic and they don't know where to start, or they were referred in various departments, they don't know where to start, we can help navigate through those platforms, or we can use such platform also to refer them to their specialized care. For instance, they are at home, they are having some infection or they are feeling some side effects of the treatment and they are asking where to start, we can use this platform to refer them. Also, we've been able to achieve improved symptom management, post-chemo administration, and they are at home and they are consulting. How can I manage this? How can I go about this? So with this, it has given us room to reduce hospitalizations or hospital admissions post our chemo administration and other treatment modalities. We've also been able to achieve an improved health information dissemination. I'll give a case in, I think, the next slide, where even clients themselves, when they get an important information they want to share with this cohort or their peers, they just post there. We've been able to achieve support psychosocial counseling through this platform. We've also been able to encourage peer-to-peer support. we've been able to encourage client engagement and consultation. At least it has given us a room to break the window of from the time I'm physically seeing my consultant to the next return to clinic. At least they can converse at their comfort. We've been able to increase our client follow-up, hence reducing loss in transition. For instance, those who've been treated and they are on remission and they are given a longer return to clinic date of even a year. This is a platform that we continually use to engage them so that even when they say, I'm starting to see certain signs and symptoms, you can call them back even before their return to clinic dates. We've been able to increase communication between the healthcare providers and the clients. And we've also been able to identify and grade the different symptom burdens that our clients go through and manage them timely. This has, in the long run, helped improve our adherence actually, because at least loss to care as a result of side effect burden has reduced. They feel that the doctor is journeying with them. So this slide just gives a snapshot of our communication through those platforms. And we are able to see, for instance, in the first,
we have 2 minutes to go.
Thank you. On the far left, we are having a client sharing a link where you can get more teachings, and they're saying, I'm tuned in. Thank you for this, very informative. I'm sorry I could not join, but kindly can they share their post-presentation slides. In this one, a client had talked about, I am overwhelmed with both burning effects and numbness at the same time. It is so horrible. It's a very horrible experience. What can I do? And you get some clients can share their experience, encourage them to hold on. And then when someone gets something on that topic of concern, they pull that information and share through that platform, and they acknowledge that it was beneficial. So during this, we've been able to share our experience on patient-reported barriers to online meetings. And basically, just to note on the result was that there was low attendee turnout. And the reasons when we tried to follow up were that 29% reported very tight work schedule, and so they could not keep in time with the scheduled meetings. 25% reported that the meeting alerts were short and they could not rebudget or replan or reschedule their engagements to attend. 20% reported that they do not have access to smartphones. 8% reported poor internet connectivity and not able to afford bundles to attend those meetings.
1 minute left.
Thank you. I'm almost done. So the challenges we've experienced are those limited access to smartphones, poor internet connectivity, and meeting schedule. Some of these challenges can be navigated through. For instance, the short meeting schedules can be planned better. In where we sit at, we see opportunities in using digital platform for coaching and mentorship, whereby you tie a multiple myeloma client with another one who's going through the same process, and they can continue their conversation. There's also opportunity to pursue in this resource constraint setting, telemedicine. This is something that have not really been utilized in our setting, and also to assess the adherence to oral medication and pick room for polypharmacy if there is. So my parting shot is that with the increasing number of cancer survivors, mHealth will provide a platform to help empower our cancer survivors and hence increase their engagement in their care. Also, future research needs to be done just to know how safe is it, cost effectiveness, efficacy, and implementation, like how best can this be done to meet the client's need and also ensure that their confidentiality is maintained. So I'd like to pass my thank you note to AMPAC as whole, which is a consortium of those institutions, and to Africa Cancer Eco Platform for giving me room to share our experience. Thank you, and back to you, Pamela.
Wow. Thank you very much, Mercy. That was a very interesting presentation and really full of, has a wealth of information that can be emulated by other partners, and it will be very helpful, especially when we are looking into cancer survivorship. And I would like to take this opportunity to open the floor for discussion, and I would welcome Mishka to say something. You've been so quiet, Mishka.
Well, thank you all. Those were excellent, excellent presentations. I don't have anything particular to say aside from definitely welcome opportunities for those of you who have joined today, both to ask questions of Mercy and Omo, but I see amongst many of the faces here, well, I'm seeing your names. Welcome those who have the bandwidth to allow the bandwidth to please turn on your video, because that will help. But I see several folks who are very active, both in patient navigation and cancer survivorship, and strengthening services and capacity. So welcome folks to also share their experiences and questions. Back to you, Pamela. I do see that Udi has her hand up.
Thank you, Mishka. I can see Udi Soko's hand up. Maybe we can start with Udi. Udi, you can unmute. And I welcome you if it is a question session. Otherwise, you can continue posting them on the chat and we are going to discuss them. And also we can give you a forum when you lift your hand, like the way Udi has done. Udi, welcome.
Thank you very much. Good afternoon, everybody. It's afternoon time here in Lusaka, Zambia. My question is, you said that you have two WhatsApp groups, one for the caregivers and the other one for the caregivers and the patients. And I've understood why you have those two. But I'm just curious as to why you did not think about, or why it hasn't come up to have a separate group for the patients themselves. Because as a patient, I'm not a patient, but I'm a breast cancer survivor. I find sometimes that being in the same room with my caregiver puts constraints on me to talk about how I feel, about my situation or about the particular caregiver and so on. But have you found that, well, maybe you haven't found the need to have a separate group for the patients on their own? I'm not sure. I think my question is very convoluted, but I think the bottom line is, how come you don't have a WhatsApp group just for the patients themselves? Thank you.
That question goes to Mercy. Mercy, I think you can be able to address that. That question goes to you. Yeah,
Sure.
what has been raised is factual. So Mercy, can you respond to that?
Sure, thank you, Udi, for that, raising that. Indeed, it's a very relevant comment, and we've not considered that basically because of the characteristics of our clients. For myeloma, it's basically considered the disease of the elderly. And so when we were checking through our clientele, we realized that most of them rely on their caregivers most of the time. And a few of them, they are elderly, and a few of them even have a smartphone that they can use to access. And most of them are in the remote areas where internet accessibility is low. So you realize that those who are actively involved in actively giving comments in our groups were mostly caregivers and a few patients. But it is something we can pursue. It's just that our feeling currently was these patients, most of them rely almost on a higher percentage on their caregivers. But it is a room we can still pursue for this few that are actively can access internet and smartphones. Yeah.
Yeah, thank you, Mercy. I think also initially when the group started, it was meant to have been for the patients, but we realized that each and every patient, whenever they were coming to attend the meeting, they came together with their caregivers. So any caregiver who came was incorporated in the group. Then later on during the discussions, it came out that caregivers needed to be separate, at least to have a separate psychosocial support group. And through that, the other WhatsApp group was developed. I think actually this, by having caregivers together with the patients, it was not something intentional, but as days goes, we keep learning. You see now through this forum, it has hit our mind that we really need to have patients alone, caregivers alone, and maybe a forum where both of them can be able to express themselves. Thank you very much for raising that. I can see also on the wall from Caroline Taylor, curious about how the peers are trained or overseen. This one I think should be addressing, is being addressed to Omolola.
Okay, thank you, Caroline. Okay, thank you, Caroline, for the question. So when it borders on how peers are trained, first of all, I would say one, there should be a buy-in. So when you're bringing in a new technology or innovation, it has to be collaborative. And so the team you're going to work with, or that would be, it's going to be made up of a diverse team, and some are coming from the engineering team, some are coming from the medical laboratory. And so first of all, there has to be a plan on how everyone with their diverse knowledge understand the goal. Okay. And then secondly, and I'll hand over to Mercy, would be on the point where you are now developing the project or you're working on the idea, you have to learn on a daily basis and reiterate. So just as Pamela said, sometimes you have to learn on it, see what's happening on the platform, and then learn from it. And so training is a deliberate process, and there are definitely a lot of tools and resources that must be incorporated into the research, the ML research being done. Over to you, Mercy.
Thank you very much, Dr. Omolola, for that explanation. Mercy, do you have something to add into it?
Okay, thank you, Pamela. Thank you, Molola, and thank you, Caroline, for that. So if I got your question rightly, like how ideally do we engage the peers? So in that WhatsApp group, we also have print specialities as part of it. So we are able to identify a peer who is either giving a comment that is constructive to our clientele, or could be a bit personalized or individualized. And so the peer or the specialities within that platform are able to identify different peers and continually give information. So it's more of a volunteering. If you have any good information you share on the platform, we continually encourage them to maintain respect for one another's opinion and desires. And we are able to handle each and every different client based on their specific needs. So those who come up with the individualized need, we link them to the specific need. Those who are giving general information, it becomes beneficial to the rest. But we are thinking of trying to pursue a way whereby those peers that are willing to share and talk much, we bring them on board to have a training and give them more information that now they can continually disseminate the rightful information. Yeah.
Thank you, Mercy. I believe that is now clear. I can see a question from Christina. Christina Stefan is asking how that she would like to ask about digital monitoring of the patients. Any solutions or part of the project? Maybe I can, that one I leave it open. I don't know whether the Omolola, you can try it.
Okay, yeah, sure. So with digital monitoring, in the presentation, I mentioned that currently we're building a platform. It's a web application that it's being embedded in one of the largest cancer hospitals. Through the platform, cancer patients can report their side effects that they're experiencing from radiotherapy. But prior to this, we had to have several focus group discussions with the patients, with the caregivers, to understand the technology available to them, what type of messaging do they want to see, what do they not want to see, even to the little details as the copy of the message. And then we've gone on to show them what the app looks like, and with their input, the app has been developed, and we started study recruitment. So with digital patient monitoring, there are a few apps across Africa that are already doing that, but most of them are in pilot phases and they're very small studies. Thank you.
Thank you, thank you. Junior Marvel has, I think it's a comment, or the advantage of separating patients and caregivers is that caregivers can also be supported, and it's a platform to debrief and discuss issues related to patients. Patients can also share experiences freely as patients without caregivers. That one I agree with you, because sometimes you find that a caregiver, a caregiver may fear to talk about the challenges they are facing with the patient in presence of the patient, thinking that when the patient, when they talk about it near the patients may feel like they're becoming a burden to the caregivers. So having these separate groups has also really helped us to learn or to get to understand some challenges which we find a way of counseling or making them as presentation as we have these support group meetings. I can remember, like, even one of the meetings that we had, we separated the caregivers and the patients. So on the other side, among the caregivers, there were husbands or spouses of those who had breast cancer. So on the other hand, the man was really feeling sorry for the wife who was now missing one breast, but he was embracing her just the way she was. On the other hand, when we were meeting with these ladies, the lady was feeling like, oh, she was not able even to undress herself near her husband, because she was feeling like, how will he see me? If he sees maybe the place where mastectomy was done, he will run away, things like that. Yet the husband had a positive feeling, but expressing it becomes a challenge. So when we had these separate meetings, we were able to at least to address them. Maybe Mercy can remember that. And what I can say is that technology advances in e-health and m-health, they are changing the way that healthcare consumers and providers communicate these days, even with their clients. And that is one area which has really helped, especially during this time of COVID-19. I can see also Caroline Taylor says, thank you, Mercy. I'm seeing a comment from Paulette, I think a question. Great presentation and well done to both presenters. My question is to Dr. Solako. How do patients track their side effects when away from the facility? Another question also, is there any communication on what a side effect is, and is there a room for tracking side effects from medication as well? So those are two questions. I think we can put them together to Dr. Solako, as the next one is from Benda. I think Dr. Solako, you can answer those ones, you can respond to those ones, and then we will take up the one for Benda next.
Okay, thank you, Pauletta, for the question. So the ProStudy app allows cancer patients on radiotherapy to report their symptoms through their mobile phone or any internet-enabled device. It also allows the caregivers to have an account linked to the patient, depending on what the patient wants. If they want just them or they want their caregivers to have access to this data. Because what we find in the hospital is at the point where we're recruiting patients onto the app, they want the caregivers to handle it. And now when the data is imputed, it can be done anywhere at home in the clinic. And the reason why we started this mHealth project is the fact that a lot of cancer patients are stranded with their side effects once the clinic that shuts down by 4 p.m. and during the weekend. And so just as the patients are putting in their data, the healthcare team, the oncology team who are serving as co-investigators on the study are able to review the data within 24 hours. However, the intervention is not to do anything other than to review it. Now we've inbuilt a clinical algorithm that grades the side effects into mild, moderate, severe with color codes, and there are patient education materials that allow the patients to know when to come to the hospital, when to self-manage or when to, and so there's a clinical algorithm that helps triage the patient. And at the moment, it's for radiotherapy side effects, but as we round up with the pilot study, we will include chemotherapy and other medications. Thank you.
Thank you, thank you. And now we are taking up the question from Brenda. From an advocacy perspective, how are you channeling their lived experiences as tools to help in improving the healthcare systems and or utilizing their experiences to improve communities' understanding of the disease and in embracing prevention? I think, Mercy, can you take up that one? How do you take their lived experiences? Yeah.
Sure. Thank you, Pamela. Thank you, Brenda, for that. Ideally, this is a new platform we pursued for now the past 1 year plus. We are trying to keep in pace with their different experiences and use it through manuscript writing to push for expanding our cancer care, especially when it comes to survivorship. I really can acknowledge that still in Kenya, survivorship for cancer survivors, survivorship care is still limited and it is not very common as we see it in the developed world. So their lived experiences, we have clients who are willing to share their story, and we normally encourage those willing to share their story to really share it out, even in their different churches, religion, converging, different community meetings, like even the barazas here in Kenya. We have those who've come on board. We also have a practice where we are trying to educate or sensitize the community health workers or health extension workers. So during such sessions, we are normally working along with our survivors who are willing to share their story on how their diagnosis process took place to now how they are living in the village, and they are able to share their experiences such as discrimination, being stigmatized by the family, by the community. And this has really changed the perception in the community in the different places that we've worked with these clients. What we need now to put together is to put together their lived experiences and indeed try to expand our cancer care here in our country and beyond.
Thank you very much, Mercy. And you know, Brenda, as a patient advocate, advocacy has to come in. Through these platforms also, we have managed to find a way of sometimes passing information. You get a new knowledge, you pass it through there. And even these survivors, they have found it a place whereby they can pass whatever they have read from different places. Sometimes if maybe things are coming up, like maybe new perspectives and things like that, they have found it, it as an opportunity to express themselves and also to let others know what is going on. I can also say that through this, we have managed to get patient navigators through their experiences and whatever they've been learning. And this is something very, very good and very encouraging. Yeah, I'm not able to.
Maybe just to add, okay, maybe just to add also to that explanation is that through also the platform that we are giving to the clients, we've been able to see their caregivers even asking, how can I get screened for this? I read somewhere that multiple myeloma is genetically related. Am I at risk? Who can assist me? And so we've been able to link them to the needed care. We've been able to link them to consultants to even screen them further. And so
please,
I know
I'm chairing a meeting, I'll call you.
Sorry for that. Okay, so we've been able to link different people, even just the caregivers that don't have the multiple myeloma disease, to the needed care. For instance, if they're just anxious that, oh, I'm having now the backache, could it be that I'm also another victim here with multiple myeloma? We are able to demystify that. For instance, we were using thalidomide, and thalidomide have certain restrictions on our clients. And so there's a caregiver who read about if you use thalidomide, you'll have your limbs getting affected, your limbs will go, and they were worried. They were like, I can't handle my mom. I can't even give her the drugs, and the mom was bedridden. So we've been able to really journey with these clients and work with them during their most difficult moment. So in such scenario, we were able to link them with a peer client and a caregiver who is providing this medication to their parents or their patient, but taking the necessary precautions. Yeah, thank you.
Thank you, Mercy. Our time is really almost up. I can see a comment from Raphael. Thank you, our very able moderators. We call her, oh, thank you very much. Mother of Oncology in Kenya. Thank you, Raphael. Another also is from Fantastic Endeavors to Journey with Complexity. That is Kimtai. These digital solutions are the way to go. In fact, they are the way to go. And unless someone has another question, I would like to take this opportunity to welcome Mr. Charles Muya to give any announcement. Unless someone has any burning question or maybe a comment that you want to put across. Seems like we are doing well. So I take this opportunity to welcome Charles. Charles, karibu, to give us any announcement if they are there.
Thank you very much, Pamela, for the excellent moderation of the session today. And thanks also to our facilitators, our speakers for today, Dr. Omo and Mercy, for the wonderful presentations. And also to our participants for being quite active today. We want to thank you for joining us in our session today. So we are going to share the slides and also the recording for today's session for your reference. So look out for that. I think early next week we're going to share that on this camp. And then our next session will be held in 3 weeks' time. That will be on April 7th, same time. We are going to be focusing on pediatric oncology and specifically on building the capacity for pediatric oncology services in Africa. We're going to be looking at the training opportunities that are there and what we can do to build pediatric oncology services in Africa. So please plan to join us. And we are also going to be sharing the agenda on this camp and by email in due course. And I think we are going to continue on together. Otherwise, I want to thank you everyone and wish you a good time. I would like to hand over to Mishka and our chair for the steering committee, Amaka, in case they have anything to add. Thank you very much.
Thank you, everyone, and have a good day and a good evening, depending on where you are. It was nice having you, and it has been a very educative session. And as I can see, Benda also says, Mercy, you can link up with Benda for the Kilele. And also, I would like to welcome you to our ANCA conference, which is going to take place soon. We have been sharing the brochure, and we will keep sharing. Thank you very much, and have a good evening and a good morning. Asante.
Bye, everybody.
Hi, everyone. Thank you for the excellent presentations.
Bye. Thank you all.